Greetings, I'm Tammy Lee Demler, your pharmacist here at the Buffalo Psychiatric Center, one of the many pharmacists actually that take care of your medication needs here at the hospital. We are going to be looking at some things to consider when visiting a pharmacy. I know last time, if you met me last week, I was doing side effects and overview of medication therapy and things to be looking out for. But today is going to be just what to expect when you're visiting a pharmacy. And we've got some video clips. I'm hoping that my technology skills will work out today because I do have some clips that I think are really good for you to see and might provide some conversation starters at the later time when your pharmacist comes up today to do the activity with you and to offer opportunities to ask questions. So I hope you have a lot of good questions to ask. So we're going to cover today a few things, 6 things really. What types of pharmacies are available? So you may drive by pharmacies or see them on TV and not really know all of the options. It's interesting because the options have gotten a lot more than when I first went to pharmacy school. There were a lot more options out there, and probably years from now there will be other options as well. But we'll talk about what options you have for pharmacies. What's the role of the pharmacist? So what does the pharmacist do? So back many, many years ago, the thought of pharmacy and pharmacists were that you really didn't see them too much. They were kind of back in the middle of the pharmacy. You could ask a question if you needed it, but you really didn't see a lot of the pharmacists most of the time. Now it's very different. The pharmacist is part of the team. They have specific roles that they play in your medication therapy, and they educate. They provide education like I'm doing today. Your pharmacist may have already discussed your medications here at the Buffalo Psychiatric Center. We're going to also look at who are the other people that work in the pharmacy with the pharmacist. So you may see a lot of people. It's a very busy place in a pharmacy. Who are those people and what role do they play? And then how to fill a prescription. What about a refill? So getting a new medication the first time is very different than getting a refill, but there are similarities. So we'll look at all of those and maybe take into account what we need to be thinking about when we get either of those two done. Or you may be picking up a refill when you're getting your new medication. That happens an awful lot. What if my prescription is a controlled substance? A controlled substance is a specific kind of medication with specific rules and regulations, and there may be a few little things you'll want to know about that if you do get a controlled substance prescription. And then what happens, it happens to all of us, what happens if there are insurance issues. So insurance issues can be very different. Many people have insurance, most people do, but there are occasionally a person here or there who might have to pay cash for their medicine. But if you're in a situation where you're feeling like you need to pay cash for your medications, it's important to talk to somebody about that to be able to link you up with an insurance company. There's many insurance companies, even if you have very little financial savings. There are things like Medicare and Medicaid, and generally, if you're in the hospital here, your social work team will be looking at what options are available to you for insurances. But there's a lot to consider with insurance, and we'll talk about that. So let's start with what type of pharmacies are available. I think this is kind of fun because you think about independent pharmacies. I have a friend who owns an independent pharmacy. This is his picture. I'm sure he would not mind that I'm using it. We used to work in a retail community pharmacy, but wanted to do something a little bit different. And so he bought a pharmacy and he opened it up and was able to help lots of people before he retired. Now, there's a lot of benefits to having an independent pharmacy as your pharmacist and pharmacy's location. You might have a little bit more personalized care. And what do I mean by that? They might offer delivery. You might get to know that owner pharmacist a little bit better. And sometimes they even live in your neighborhood. So I think there's a lot of benefit with that. And it's a local business. So that person's a business owner, but they have to be a pharmacist if they're going to be if a pharmacist has to be in charge of the pharmacy. So a person who is not a pharmacist can buy a pharmacy, but they need to have a pharmacist hired to be able to run the pharmacy. So many times it's a pharmacist owner who owns an independent pharmacy. So you might hear about that word independent. There's also retail pharmacies. Retail pharmacies are community pharmacy, chain pharmacy. There are a lot of them available around in our communities. Walgreens is just one example, and I highlight Walgreens because they actually work with our hospital and provide after hours medication where our pharmacy is closed here at the hospital. They will help provide medicine if you need any during the middle of the night, so to speak. But generally, our pharmacy provides everything that you need, and we have a lot of backup plans for anything that would run short or that. But if sometimes things happen and you need something that we don't necessarily have in stock too during the day, so we work with Walgreens to provide that. But there's Rite Aid, there's CVS. You could probably name something that I'm forgetting. Wegmans, grocery stores have pharmacies now too. So there's a lot of options there. Some benefits with a chain or retail pharmacy that way is that there are a lot of them, and they are found in different locations. So if, for example, you are visiting a friend down maybe in another town, and you need a prescription for whatever reason, there's a blizzard, I don't know. The chain pharmacies have computers that are linked, and that may be able to be something that you could take advantage of. You could perhaps get a medication at a different location, depending on the kind of medication. But that's an option. So they're convenient. There are many in different locations, and you might be able to use that as an advantage. Hospital pharmacy would be what we have here in our hospital here. Our hospital pharmacy looks different than maybe ECMC's hospital pharmacy. Hospital pharmacies are really based on what patients that they have. Our patients here at the hospital here tend not to need any kind of IV injections or serious medical interventions where there's no surgical suite or things like that. Where you might need medication that is dripped from an IV into your blood, we would get that over at ECMC where they have the proper equipment to make those. It requires specific equipment to make medications like IVs, and here at our hospital, that's not our specialty. We do other things that ECMC perhaps doesn't. So different hospital pharmacies offer different things. And then last, I'll sort of summarize on the mail order pharmacy component. A mail order pharmacy is sometimes based on your insurance cards. Your insurance company may say, we prefer a mail order pharmacy for you. Or some patients prefer it because it's more convenient. The medication just gets shipped from a mail order house over to your house or residence, and then you're able to just pick it up from the mailbox and then not have to worry about going there physically, which might be good in the winter weather when maybe we wouldn't want to drive or be out in the cold. With that, you have to be really careful because medications are very temperature sensitive. So you need to make sure that that medication is properly stored. For example, insulin needs to be stored in the refrigerator, but it should never be frozen and it should never be exposed to hot temperatures. And in Buffalo, as you know, it can be 0 degrees or 100 degrees depending on the season. So if you get medications in the mail, you need to make sure you're getting them quickly out of the mailbox and put into your home where the temperature is regulated. So this is going to be where I delve into the video component of the program. I'm hoping this works out. This is just what it takes to be a pharmacist. You may not have ever thought of this, or some of you may have maybe thought of it as a career, but I think it's good to know that your pharmacist is very qualified and very educated, and they know a lot about everything to do with medication. So if ever you have a question, you can ask them. But I'm going to play this video, and it'll tell you a little bit more about what it takes to be a pharmacist. Let's hope this works.
Okay. You can see here, you can so you know, here's the steps you can take today to get yourself started on making your goal a reality. We'll talk to you most of them. I'm going to like your job. How long it took them to complete their education. And what their average day is like. Volunteer in a hospital. This will get you familiar with medical people, terminology, and pharmaceuticals. Sign up for a chemistry or biology course. Get a job as a clerk or cashier in a pharmacy. That way, you can get paid to learn on the job and keep firsthand with pharmacy tech. Like what you see, you're all set.
Video, and I'm hoping that this one works as well, because this is a simulation of an interaction with a pharmacist that could be very helpful for you to be a little bit more comfortable if you need to approach a pharmacist.
No problem. I have some thoughts. I do notice that the prescription from the hospital. More about that? 10 days. I had this infection where the fluids are. I need my refills. I didn't get any prescriptions in the hospital. I did have some auto refills for you. Unfortunately, I couldn't tell you the doctor to pick them up. But if you can give them 20 minutes, I can get them ready for you. What's the thing I ankle leaving the apartment? It's hurting real bad. I tell them, that's the first day I got from the hospital. But I didn't want to talk about one thing. Ibuprofen for home, especially with the medical conditions, I have a tendency to reduce blood pressure quickly. Really? They told me I couldn't take Tylenol, but I thought that ibuprofen would be okay. At the hospital, when I first got there, they said my kidneys weren't doing too good. But when I left, they said everything was back to normal. Well, you know what, John? You can go over the diet and I can discuss with you further. And then do your ankle thing? Sure. Is it hurting more or is it moving? No, it's the same. I think the best thing now is when you get old guy and elevate your ankle to 45 degrees. I'll let you grab that for you. So this is the cold pad. So this basically activated you swinging like on your ankle and elevated to 45 degrees. And the reason why I put one something with this recommendation is because you told me about your kidney problem in the hospital, I don't know if you're comfortable with using ibuprofen, and then because of your liver condition, the fluid is flowing in your abdomen, which is restricting blood flow to the kidney. Ibuprofen will further restrict blood flow to the kidney, and your blood pressure medication, like Synapse, is not a very good medication that will further reduce blood flow to the kidney. And the total effect of all three of these factors will drastically reduce blood flow to the kidney and the kidney failure. And that's why I feel more comfortable with the whole factor recommendation. And if you have further questions, we can answer them. Thanks for letting me know about this. Certainly don't want to hurt my kidneys. I got enough problems. While we're here, and if you want to bring me back to the pharmacy, I can get all your prescriptions on the equipment.
That you're enjoying these little vignettes. This one is a little longer, but it shows what would be considered an interaction, a consultation with a pharmacist. So you may have had the experience of having a consultation with your pharmacist here at the hospital. You can always ask for a consultation or education with your pharmacist and get to know who your pharmacist is. Every unit has a pharmacist assigned, and you probably have hopefully interacted with them already at this point. But let's look at this little video vignette about this particular pharmacist who's helped.
Such as common side effects, potential drug interactions, or medications in take. Despite best efforts of doctor and pharmacist, there are times when adverse effects occur after starting a medication, or effectiveness of prescribed medication may not be fully realized. In order to promote the safe and effective use of medications, a growing number of health plans are offering to their members a benefit commonly referred to as medication therapy management. This benefit, typically offered at no additional cost to cover members, is designed to help patients get the best results from their medications. It is centered around you as a patient and involves both pharmacists and prescribers involved in your care. One example is a comprehensive medication review, which is designed to help identify or prevent drug complications, reduce costs where appropriate, and help you get the most benefit from your medications. This video will define and demonstrate successful medication review.
Hi, Jim. Thanks for coming in. The focus of our meeting is to identify all the medications you're taking. We'll talk about possible medication-related issues or cost savings opportunities. After we finish, I'll send you a copy of your updated medication. Okay, let's talk a bit about your current medical condition. I've noted them based on the medications I've filled for you, but I'd like to confirm these are correct and you aren't missing any.
Sure, okay.
The conditions I've identified are diabetes, asthma, and high blood pressure. Is this correct? Anything that I've left off?
I don't think so. But in the past, my doctor has told me my cholesterol.
Your doctor ever prescribed any treatment?
Years back, yes. My doctor gave me a prescription. But my neighbor told me she uses something over the counter. It works, so I've been using that instead.
And do you know the name of the product?
Yeah, fish oil.
Okay, I'll note that. We'll talk about it when we address your over-the-counter medication.
Okay.
Before we discuss your prescription, can you tell me if you have any allergies to medications or food?
No, I don't have any allergies. Well, none that I know of.
Any other health issues or concerns?
Well, I've started to get a strange tingling in my feet. Do you think this could be related to any of my meds or condition?
It could be a complication of your diabetes called neuropathy. It's something I can discuss with your doctor to see if you might benefit from a medication to help relieve that symptom. Would that be okay with you?
Oh, sure, that'd be great.
I've started a list of all the medications you filled at our pharmacy. Let's review it and confirm that these are still current.
Okay.
I see that Dr. Nguyen has you on 500 milligrams of metformin for your diabetes. Are you still taking it?
Yeah, I've been on that for about 5 years.
And how are you taking it?
Twice a day, with my meals.
Okay. That's what my records show. It can be difficult sometimes to remember when and how to take medication. Many patients miss a dose here and there. During an average week, how many doses would you say you miss?
Well, I do pretty well remembering both doses. But sometimes I forget to take my medicine. I'd say I miss maybe one dose a week.
That's perfectly understandable. And there are various tools to help you stay on track with your therapy. We can talk about this after discussing your other meds.
All right, good.
Metformin can sometimes upset your stomach. It can also cause some side effects like nausea, vomiting, and diarrhea. Have you in the past, or are you currently experiencing any of these side effects?
No, no side effects.
How about your blood sugar readings? How have they been since starting metformin?
Well, they've gone down a lot since I started using them.
Good. And how often are you testing?
Every day. I test every day after lunch.
According to my records, the doctor also wanted you to test in the morning before breakfast. Does this sound correct?
Yeah. I stopped testing in the morning to cut down the amount of strips I'm using. That, well, my sugars after lunch are going down a lot. So I figured it was okay.
Well, it's good that your glucose readings after a meal come down. But since you're also using insulin, it's important that you also test in the morning. The reason we have you test on an empty stomach and after a meal is so that we can see how your body is handling sugar, both while at rest and after eating. The goal is that your readings will stay at a fairly even level instead of having wide swings back and forth.
I guess I didn't know that. Well, I'll start testing twice a day again, but I will need to get a refill of my strips while I'm here.
No problem. We'll take care of that after we're finished. Now, before we move on to your next medication, do you have any questions concerning your metformin?
No, I don't believe so. That covers it.
Okay, now that we've been through your prescription medications, did you bring in any over-the-counter meds? vitamins, or supplements?
Well, I run on ibuprofen. I use it sometimes when I get a headache.
How often would you say that you use it?
Oh, maybe once or twice a week.
Is it effective for you?
Yeah, but I don't use it all that often. And sometimes it upsets my stomach. But it does make my headache go away.
All right, I'll add that to your medication list. One thing you may want to try is taking acetaminophen or Tylenol instead. This will be easier on your stomach. It's also a better option due to your high blood pressure. Tylenol will increase your blood pressure like ibuprofen can. Well, I think we've gone over everything that I planned. Any additional questions or concerns that you have today, Jim?
I can't think of anything.
Great. Well, thanks so much for coming in. I'll finish updating your medication list and send it out to you to follow up to our appointment today. Like I mentioned, I'll also consult with your doctor about a medication to help with the tingling in your feet and discuss your recent cholesterol levels to see if they're well managed with fish oil. If there are any changes to your regimen, I'll contact you. Does that sound okay?
No, that's fine with me. Thank you for your time. This was really helpful.
You're welcome.
We hope this demonstration of successful comprehensive medication reviews will give you a better understanding of what should occur in delivering this service. With 4 out of 5 adults taking some sort of medication daily, and the high cost of non-compliance in the healthcare system, the value of CMR should be clear.
That made you want to have a consultation with your pharmacist and being able to sit down and just look at all your medications and ask questions. That's part of what this medication group is all about as well. So let's talk about some of the people in the pharmacy that you might see working behind the scenes with the pharmacist. So we have pharmacy technicians, which are people who are trained to help the pharmacist dispense medications, but they are not pharmacists, so they can't provide education or information to you. They can provide information, but not about your medication. So it's general information. We have pharmacy students that are called interns, so they're pharmacists in training. They would wear a badge. You can always ask everybody who they are, so everybody should be having a badge on. Pharmacy residents are pharmacists who have passed all of their exams, but who are now in specialized training. So we have a pharmacy resident here, and Dr. White is our pharmacy resident, and I'm sure you're familiar with her wonderful teaching skills. She's been part of the med group experience now for a number of weeks. And then we have just cashiers. Now at the hospital pharmacy, we don't have any, there's no exchange of money, but at a grocery store or a chain pharmacy or even independent pharmacy, there's going to be a need for purchases, and that's cashiers can do that. So cashiers can sometimes be pharmacy technicians, but pharmacy technicians can sometimes also have specialized training. Okay, so how to fill a prescription, how to get a refill. These are just some things to think about. So your prescriber, and it doesn't have to be a doctor, it can be a nurse practitioner, it can be a physician assistant. There's a lot of prescribers out there, so that's the word I'm using. You may have a medical doctor who's taking care of your care. But now the prescriptions are electronic, so they're sent by computer to computer, so there's no more paper. Unless there's some sort of failure of the computer, paper usually isn't something that we use. But electronic prescriptions go to the pharmacy. It takes a while, though, for the pharmacist to be able to get those down out of the computer and make them be your prescription finished up. So save a trip, call before you go to make sure it's ready so you're not standing there. And also there may be some things that the pharmacist needs from you. So sometimes they need to get more information from you if you've never had that medication before, such as, are you allergic to this medicine? They also have to maybe ask sometimes to order the medication if it's something they don't usually stock. So there may be, everything is good, they're just waiting for the medication to arrive. Sometimes the pharmacist needs to talk to the doctor. There might be a drug-drug interaction, or they may have been, what they ordered was not clear, so there might be waiting for a call back from your doctor. And sometimes an insurance company gets involved and they will want to know more about why you need the medicine, especially if it's something that's unique or expensive. So calling that pharmacy before you head over there will save you a trip to come back if you have to wait. What about a refill? When you're giving refill, call ahead and give enough time. It's not just that they're putting that medication in a bottle and sending it back to you. There are people who have come in before you, people who are in urgent need possibly of a new medicine. So there's a line, a queue, and there may need to be some time given. Some things that look refillable aren't. So even if you have like a refill of one left on your bottle, it may have, the time may have expired. There may be other issues about that refill. So again, make sure that you're calling to confirm before you go. Try not to wait too long to pick up your medications because, as you saw in the video, the pharmacist had to return that medication to stock because of a number of reasons. Number one, sometimes the policy of that pharmacy is that it only is on the kind of the pending to go shelf for only a period of time. But some insurance companies require that charge is reversed back if you've not picked up the medication. So also there can be reminders if you forget to get a medication refill. You can get on the list for a phone call, a text reminder if you have if you get text messages on your cell phone. And sometimes you can even be put on a refill status that's automatic. You don't have to even call to remember to have them refilled. They'll refill your medication for you, which is sometimes nice if you just get real busy. As long as there's no changes to your medication, I would suggest that you use your current supply up. If you have a few days left of that before you move to the new bottle, you want to not use a medication that's expired. And sometimes if we push aside old supplies that are just a few pills left, you might forget how old those are. So I always say use those up first. I would not recommend pouring them necessarily into the new bottle because there can be color changes and that sort of thing. If ever there's a color change, ask your pharmacist about why, because it might be a new brand, but you want to make sure it's not a mistake, and mistakes can happen. And then, of course, make sure that if you have concerns about expiration dates, ask your pharmacist. They can help you understand what you need to know. And then controlled substances. I promised I'd mention this. Controlled substances can be either medications for pain, medications for sleep, like Ambien. Many people might take Ambien, pain medications, benzodiazepines for anxiety, so lorazepam, clonazepam. You may already be on something like that. Those specific medications can't be refilled early. You can't get double the amount. You have to make sure that the refills are within the period of time that the drug the prescription drug is good for. So it's important to ask your pharmacist about the details there. Never take that medication out of the bottle unless you're at your own home for organizing your pill organizer, because the medication is very strictly regulated. It needs to be in that bottle with the orange label, and it needs to have your name on it. You can't share that medication, and you should never have it out of your sight. You should always have it stored properly so that there's no chance that somebody might take that medication by mistake. There might be insurance issues with your pharmacy. Again, remember to call your pharmacy, make sure that everything is okay. Sometimes if there's not a medication, if your medication is not covered by your plan, there can be a similar medication that can be ordered, possibly like a generic version or another company's version, so the pharmacist can help with that. But sometimes the insurance company needs to talk to your doctor or your prescriber to find out specifics about that prescribing choice. So again, this is all time that needs to be given to the pharmacist to work through those scenarios. And then to keep us on target, we're just going to do a quick little wrap up and review. And this is a quiz. Are you ready? So what type of pharmacies are available? We have a choice of community pharmacy, drone delivery pharmacy, email pharmacy, or all of the above. What do you think? Community pharmacy, yes. Now, someday there might be drone delivery, but right now it can go through the USPS, so the United States Postal Service, or there can be a delivery by a person to your home, but right now, no drones. Email pharmacy, no such thing. You might get email alerts from a pharmacy, but there's no pharmacy that is an email pharmacy. Now, there can be intranet pharmacies where you can connect with somebody electronically, but internet pharmacies there can be a lot of risks with those, so I would suggest you talk to your pharmacist about any kind of alternative online purchases because it can be not safe. All right, how about this? What is the role of the pharmacist? So they oversee safe medication use. They caution about over-the-counter drugs. They provide health and wellness recommendations. They administer vaccinations. Which of those do you like, or do you like all of them? I agree. All of the above, right? How about this? Are there other people who work in the pharmacy, and what do they do? Pharmacy students, pharmacy technicians, pharmacy cashiers, or all of the above? Of the above. And the funny thing is that a pharmacy student can be a technician and a cashier as well, so they can be sometimes all of those things. How about when filling a new prescription or refilling one? It's best to call ahead to confirm it's ready. True or false? True. It can save you a trip. What if my prescription is a controlled substance? What should I remember? Options are refills may expire even if I didn't use them all. I should store these only in my pill organizer when I travel. I can share these medications with my good friends. Or do you like all of those? I don't. I only like A. The refills can expire even if you didn't use them up because the prescription has a lifespan that's limited. So even if you've got a refill, you might have to get a new prescription. But again, never store those medications that are controlled in a pill organizer when you travel. You need to have them in the original bottle with that orange label. And you should never share medications with friends, especially controlled substances. That is not a good idea. And with that, we're out of time. I want to thank you so much for joining us, and we'll see you next time. Take care, be well, and enjoy your pharmacist interactions. They'll be up soon.